So before we begin, please grab something to write with and write on. This session will have many opportunities to pause and reflect and acknowledge the ways in which your cancer diagnosis has impacted you. Let me introduce myself. My name is Susan Ashley. I'm an oncology social worker with over 22 years of experience in cancer care. I'm currently the Vice President of Clinical Services at the Cancer Support Community. And today we're going to talk a little bit about why you might not be able to stay positive and the ways in which depression and grief and distress can impact your experience, and the approach to resilience, the way to strengthen that muscle for your future. So here's where we're headed. We're going to talk a little bit about the universal challenges of cancer. We're going to recognize the symptoms of both distress and depression. I'm going to point out how you can honor and acknowledge your grief and learn ways that you can strengthen your resilience and really weather the storms of life that present themselves with a diagnosis. The Cancer Support Community is a global network of affiliates. We provide free education and support across the United States, in Canada, Japan, and Israel. And our mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. And at the end of my presentation, I will tell you ways in which you can connect with the Cancer Support Community, both nationally and in your local neighborhood. So let's start first by talking about the universal challenges of cancer. Get your pen and paper ready, because I want you to think about your own experience, and perhaps one of these universal challenges really speaks to you, or perhaps you want to write something else down. So one universal challenge is the loss of hope. Perhaps it's not loss of hope for you, but interrupted or disrupted hope, what you thought life would look like. For some, the challenge is a loss of control, not being in control of tomorrow, of your calendar, of if cancer treatment will work or not work. Living with uncertainty is another universal challenge. And it is one that is a parallel process for those of us also experiencing COVID. And finally, unwanted aloneness, that sense of social distance and social isolation. So take a moment. Do any of these universal challenges describe your experience? Let's look down this list. Since 2013, the Cancer Experience Registry, which is developed by the Cancer Support Community's Research and Training Institute, has provided a forum for people impacted by cancer to share their voices about issues that matter to them and to help them connect with one another to ensure their experiences are communicated to the broader cancer community. On the slide previous, we talked about some universal challenges. Let's look more deeply. So here, over 2,100 patients in treatment and post-treatment acknowledge that these were the top 10 concerns. And since 2013, these top 10 concerns have appeared over and over again as the universal challenges for cancer patients. Eating and nutrition at 62%. So folks said that they were moderately to very seriously concerned about eating. I want to point out those other things that really lead to distress, worrying about the future and what lies ahead. Health insurance and money issues. Changes or disruptions to work, school, or home life. So as I pointed out on the Cancer Experience Registry, over 53% of patients in treatment and post-treatment are worried about the future and what lies ahead. This speaks to the very heart of living with uncertainty. It can look like having plans put on hold, fear that treatment will not work, that treatment will stop working, or that you might die. We can't talk about the universal challenges of cancer, distress, depression, and grief without first acknowledging the concept of same storm, different boat. While all of you here have a similar diagnosis, that doesn't mean your experience with that diagnosis is the same, because we are all in different boats. So comparing yourself to the way someone else is coping, whether that is someone with the similar diagnosis or a friend or a caregiver, misses the point. While we are all experiencing the same storm, a cancer diagnosis, we experience that storm quite differently because of the boat that we have. What's in your boat? Do you have the resources, both internally and externally, to cope with that storm? And we're going to talk about the ways, and here in a few moments, that we can resource our boat and strengthen our resolve to have endurance and fortitude no matter what storm we confront. So here are some things that deplete our resources, those things that we need in our boat. Unmanaged distress. I'm going to talk further about that in a moment. Untreated and unrecognized depression. Unrecognized and unacknowledged grief. And limited social support. As you can see, these resources that can deplete us mirror those universal challenges of cancer: isolation, hope, uncertainty, and control. Let's first talk about distress. Distress is a mix of anxiety and depressive symptoms. It can cause sleeplessness, lack of appetite, trouble concentrating, and even difficulty carrying on regular activities. Although some distress is normal, about a third of all cancer patients experience significant distress, and only about 5% of those with cancer obtain psychological help. While distress may not affect the cancer itself, it does affect how you cope and your ability to follow treatment recommendations and to connect with others. We know that there are some predictable stress and distress points for you. That when you're first diagnosed, when you're in the midst of a treatment decision, as you wait for the results of your scans and blood work, when you learn that cancer has progressed or recurred, and when you have to make that transition from work to disability. So let's take a moment to look at distress and how it impacts you. So I want you to ask yourself and write down, as you go through this list, today, how concerned am I about? And I want you to write those statements that are either moderately serious or very serious concerns for you. So perhaps when you ask yourself, today, how concerned am I about feeling irritable? You might say not at all. That's all right. Go on to sleep problems and ask yourself that same question. I do want you to write down those statements that you are moderately to very seriously concerned about, because in a moment, I'm going to tell you what you should do with that to get help from your physician. So I'm going to pause for a minute and let you work down this list and really ask yourself today, not last week, not tomorrow, but today, how concerned am I about? Now, as you can imagine, if we were sitting in a room together during this session, all of you share a similar diagnosis, the same storm, but you would have very different experiences. Some of you are very concerned about finding meaning and purpose, while others are very seriously concerned about making a treatment decision. So going back to my example of same storm, different boat, you can see that it is meaningless and useless to compare yourself to someone else. Your experience with this storm, the storm of cancer, is unique to you. So at your upcoming visit with your oncologist or your oncology nurse practitioner or social worker, I want you to bring this list and let that healthcare team know those serious and very serious and moderate concerns that you just acknowledged. Because as you remember, distress is something that is significantly underreported and has significant impact to quality of life. Asking for support and resources and for your distress to be acknowledged is not a sign of weakness, but a sign of great strength. So the title of this talk is Why Can I Not Stay Positive? And many years ago, Dr. Jimmy Holland coined the term, the tyranny of positive thinking, in her book, The Human Side of Cancer. And for many, you may have experienced this burden that you need to stay upbeat and positive, or you fear your cancer will come back, or will recur, or will progress. But we know that that's not true. So the burden of positive thinking can manifest in many ways. First, it can look like the inability to acknowledge that cancer is a difficult and frightening experience. It is an insistence that you put on a happy face even when you don't feel well, emotionally or physically. It can look like feeling guilty or ashamed because you are unable to maintain a positive attitude even in the face of a difficult and frightening experience. And it can also be a belief that a wide range of emotions is unacceptable, as if feeling sad means that tomorrow you might not feel joyful. So let's take another moment to pause and to ask yourself, in your experience with cancer, have you ever felt the pressure to think happy, to put a smile on your face, to refuse to see the full experience of your cancer? How did it make you feel to have this burden of positive thinking placed upon you? For many, they report that they feel afraid, that if their family or friends knew how sad and upset they were about their cancer diagnosis, that they would let their family and friends down. They worried that if they tell their physician that they're having the wide range of emotions and experience with cancer, that perhaps their physician will think differently about them. Perhaps you've had your own experience with this pressure and this burden. So we've talked a little bit about the universal challenges that people with cancer face. We've talked about the tyranny and the burden of positive thinking and cancer-related distress. And now let's talk about depression. And here's what we know about depression and cancer. It's common. Approximately 1/3 of cancer patients report a mood disorder which means depression or anxiety, at some point after diagnosis, and with the first year after diagnosis posing the greatest risk. And about 20% of cancer patients continue to report depression and anxiety after the initial stress of a diagnosis or recurrence. Further, more than half of cancer patients and survivors report fatigue as an ongoing issue, and a large number of cancer patients continue to struggle with pain and isolation. Across all registry respondents, nearly 1/3 or 30% reported substantially worse anxiety than the national average, and 20% of cancer patients and survivors reported worse depression symptoms. So what we know about depression and cancer is that it is very common. So get your paper and pen ready, because now I'm going to describe what depression feels like and looks like. And as we go through each slide, I want you to jot down the symptoms that really reflect your experience or resonate with you. So we're first going to talk about mood-related symptoms. And the reason why I go through each symptom, from mood to physical to behavior, is because sometimes we just use depression in a very vague way. Depression deserves specificity, because without specificity, we can't find the right treatment and support for you. So let's start first with the mood symptoms. Are you feeling down or sad? Perhaps you're feeling hopeless or irritable. Perhaps your mood is more numb, the experience that you can't quite feel things. Or perhaps you feel worthless. Now, it is okay if you feel many of these things, but write those down. So depression also has physical symptoms. And I'm really going to pause and talk about the physical symptoms and how often they can be confused with the side effects related to cancer and cancer treatment. And this is why specificity is so important. Your physician needs to know the wide range of experiences that you're having so that he or she can understand better. Is this mood related? Or is it related to cancer treatment? Or is it a bit of both? So let's look at the physical symptoms. Fatigue, appetite loss. Some of you might be shaking your head. You've just completed treatment or you're in the midst of treatment. Very common experiences for folks with cancer. Insomnia, which really looks like not being able to fall asleep or stay asleep. Or perhaps it's hypersomnia, feeling sleepy and feeling like you need to sleep all the time. Some other physical symptoms are sexual problems, such as lower sexual desire. So I'm going to take a moment and pause and invite you to write down these physical symptoms you have. So depression can also have behavioral symptoms. A loss of interest in activities that you used to enjoy, that used to bring you joy. Perhaps you have frequent crying, that you cry out of the blue. Perhaps you're feeling like you really want to withdraw from friends or family, and you're surprised by that. Loss of motivation to do daily activities, the inability to really get started. So ask yourself, Do I experience some of these behavioral symptoms? And if so, which ones? Now let's take a look at some of the cognitive symptoms, the ways in which depression impacts our brain. And again, you might look at this list and you think chemo brain and all of the other things you may have experienced since your diagnosis of cancer. Again, this is why I have stressed throughout the past few slides how important it is to be specific about what you're experiencing so that your treatment team can have a specific resolution for you. Trouble focusing, difficulty making decisions, memory problems, negative pervasive thoughts. And in extreme situations, these may include thoughts that life is not worth living or thoughts of maybe hurting yourself. Do you experience depression cognitively? And if so, how? Please write that down. So while distress and depression are extraordinarily common, it is also often underreported by patients out of fear of stigma or the concern that people won't think that you can't maintain a positive attitude. But I cannot stress enough how important it is for you to walk into your next visit with your physician and healthcare team and report all of these symptoms, to ask for support, for a further assessment, and for resources. We know from the research that depression impacts quality of life. It decreases your adherence or your ability to maintain the cancer treatment protocol and can increase longer hospital stays. It is important that for you to know that there are some risk factors involved. If you have a previous diagnosis of depression or anxiety, a family history of depression or anxiety, perhaps a lack of support from friends or family, or financial burdens, these all can compound and complicate depression and are important for you, in addition to all of the other things that you've written down, for you to acknowledge and report to your healthcare team. What we also know about depression and cancer, besides that it is common, is that it's treatable. Both psychosocial interventions and medication are effective in treating depression and cancer. Although in the literature, the optimal combination and delivery of those treatments aren't perfectly known, we do know that the management of depression is likely to be different in each patient. Again, we go back to the metaphor of same storm, different boat. If you compare yourself to someone else with depression, their experience and their treatment, it will be unhelpful to you, because we know that the management of depression is likely to be different for each patient and each person. There was a large study on the treatment and improvement of depression in metastatic breast cancer. And what we saw was an improvement of depressive symptoms, significantly prolonged median survival, and improved quality of life significantly. So I mentioned there are many approaches to cancer treatment, one of which is medications. There are different types of antidepressant medications which are available. Your doctor will either select the most appropriate antidepressant or will refer you out for a further assessment with a psychiatrist or a psychiatric nurse practitioner. The antidepressant will be picked based on your needs, your symptoms, the potential side effects, other medications you might be taking, and your medical history. Please tell your doctor about all the medications and supplements you take, because some may interfere with types of antidepressants. Some people will see an improvement 2 weeks after starting an antidepressant medication, but often it takes more than 3 weeks and up to 6 to 8 weeks for the medication to have full effect. So once you get started, please don't get discouraged if you don't see immediate results. Medication is particularly effective for improving mood and the physical symptoms associated with depression. And we talked about that in previous slides. Adding psychological treatment, counseling to the medication may be even more helpful in managing negative thoughts and low self-esteem that can accompany depression, and helping you identify other coping strategies. So let's talk about some of the ways that you can get help for your depression in addition to medication. In addition to medication, you may benefit from a range of approaches, including relaxation strategies, exercise, psychoeducation, what we call cognitive behavioral therapy, which we loosely call CBT, problem-solving therapy, or PST, and acceptance commitment therapy, or ACT. CBT, we're going to start with first. It identifies and equips patients with the skills to overcome negative, or what we call maladaptive, thought patterns, and encourages emotional readjustment. Both psychoeducation and CBT, cognitive behavior therapy, has been demonstrated to be effective in improving depressive symptoms and enhancing quality of life. ACT, or acceptance commitment therapy, teaches you how to tolerate and live alongside difficult thoughts without becoming overwhelmed or dominated by them, and really helps you develop psychological flexibility, emotional flexibility. ACT has been demonstrated to be as equivalent to CBT in terms of its effect on mood and quality of life. You also see on this list exercise and mindfulness intervention. I'm going to go a little bit more deeply into mindfulness in a little bit, but I can tell you exercise is very effective. Getting outside, taking a walk, even if it's for a few minutes, can really enhance your mood and help you feel more hopeful. But again, you want to work with your treatment team on identifying the right approaches. There's not going to be just one approach. It's going to be approaches to help you adjust to and live alongside distress and depression. We often overlook grief. And unacknowledged grief can really deplete your resources. And as I go through each of these types of grief and loss, I want you to write down words or phrases that really capture your experience. One form of grief is what we call a living loss. This represents how we may experience chronic or ongoing sadness and sorrow. It is the space between what is and what should have been. This may capture how you thought you would be spending your time at this point in your life, compared to how in reality you are spending your time because of cancer. Another form of grief can be what has been described as ambiguous loss. This type of grief involves a sense of loss that may be unclear and defies resolution. Many people with cancer who will be treated chronically, who may not have a cure, experience ambiguous loss. You may feel a sense of loss, but not be able to fully know exactly what you've lost which can complicate your experience. Cancer can also result in what has been termed the loss of the assumptive world. We typically develop a sense of the world and develop assumptions or a belief that help us feel in control. And remember, the loss of control is a universal challenge. These beliefs can give us a sense of security and stability, a way of managing uncertainty, and help us make sense of our experiences. This might be that if we work hard enough and are a good person, then we'll have a good life. Or if I'm a vegan and do yoga every day, I won't get cancer. These sorts of beliefs can form our core beliefs about ourselves and about what we expect to happen in our life. But in the face of illness, in the face of cancer, or in struggle, these beliefs can be challenged, which can feel disorienting and confusing. We may feel stuck trying to make sense of why we are having to go through something so difficult and that it doesn't fit with how we thought the world should work. Another type of grief is called disenfranchised grief. This is when grief is maybe invalidated or minimized. Perhaps it's unacknowledged. Disenfranchised grief can come up during those moments where we feel forced into the tyranny of positive thinking. We may feel a sense of loss that is not recognized by those people around us, such as when people might say someone should just be happy to be alive, rather than expressing understanding why someone might be sad that their cancer treatment will have no end. This type of invalidation can happen from significant others, from friends, from healthcare professionals, and perhaps it is even internalized when we try to talk ourselves out of feeling grief. So let's take a moment. Are you experiencing living losses? Are you having trouble with what is and what should have been? Or maybe you're experiencing something closer to ambiguous loss. Or perhaps you fit more into that loss of the assumptive world. This is not how life was supposed to look. Or perhaps you're feeling invalidated or minimized, experiencing that disenfranchised grief. So it's time for another reflection, a time for you to write down what you are grieving, those things that you feel you've had to say goodbye to, either temporarily or permanently because of your diagnosis. Perhaps you want to write about how you can honor and acknowledge your grief, and who you might want to tell at the end of the session about your experience with grief so that it can be acknowledged and seen. So unlike the burden of positive thinking, hope dies last. Activating hope, looking at hope from a different lens, is where we're going to spend a few moments of time. We know from the research that there are some things that underpin and help us re-engage and activate hope even during the storms of life. And we know that self-compassion, the act of seeing ourselves with kindness rather than harshness, being able to contribute to life, having that experience that life still has meaning even during my cancer, acknowledging the full range of emotions and experiences rather than avoiding, really reducing that unwanted aloneness and isolation by reaching out for support and help, and cultivating resilience are all things that we can do that contributes to finding hope and renaming hope. I'm going to spend a little bit of time on cultivating resilience and how resilience and fortitude can work together. So the great news is that we are not born with resilience or not born with resilience. It is a trait that we can learn. It's a muscle we can build. And there are many ways that we can define resilience, from bouncing back from adversity to more hopeful adaptation or growth during cancer or a life disruption. Most agree that resilience is a process. It's not a one and done. And it begins after a significant life difficulty. So the great news is resilience requires the storm, a significant life difficulty, to begin. And it involves ongoing recalibration. That idea that you don't just work your biceps once and think that they will always stay firm. It's a daily action that we take. Dr. DeShields and her colleagues propose a model for resilience that recognizes the ways in which individuals experience the world before cancer and their ability to cope with cancer after a diagnosis. In this model of resilience, mindfulness is the foundation of resilience, because mindfulness allows the individuals to remain present in whatever challenges life presents. So when you look at this picture on the screen, you see that recalibration, that everything here is in a circle, that sometimes we experience significant distress. And on the continuum of distress is also resilience. But regardless, the intervention is always mindfulness. It allows us to recalibrate and come back to ourselves. Mindfulness, like resilience, is a skill that can be learned. Mindfulness can be helpful for a wide range of physical and psychological symptoms and outcomes, including anxiety, distress, depression, fear of recurrence, fear of dying, fatigue, chronic pain, difficulty sleeping. It has also been related to increasing perceptions of social support, optimism, and overall quality of life. So mindfulness can be the antidote of those universal challenges that we talked about at the beginning of our session. So let's try it for a moment. And perhaps many of you have mindfulness practices already. You meditate, you listen to guided imagery, you do chair yoga. Regardless, I'm going to invite you to find a position in which your body is comfortable and is as free of pain as possible. Please close your eyes or just look down at the floor, doing whatever you feel you need to feel comfortable. Now take a few easy, slow breaths. And with each breath, simply move into your body. Notice where it holds tension or where it feels loose and easy. Perhaps you want to start at the top of your head and slowly, with each breath, check in your neck, your shoulders, your chest, your belly, your thighs, your shins, your toes. Simply begin to notice your breath, feeling your stomach rise as you breathe in and lower as you breathe out. Simply notice the rhythm of your breath. And it is only natural that your mind might wander. It's normal. Just gently remind yourself to return to the breath, noticing how it rises in and lowers as you breathe out. So stay in this moment, gently breathing, connecting with your breath. Allow yourself to feel whatever you are feeling and to be present with your current experience. No matter what emotions or feelings arise, note them with ease. Now take a few more easy, slow breaths. And come back to this presentation. There are 3 daily actions you can take to strengthen your resiliency muscle. They come right out of the literature and the research. Number 1 is look for the good. This really counters the idea of positive thinking. Positive thinking is manufactured and doesn't allow you to look at the full range of your experiences. Looking for the good is a practice of gratitude. It's important to note that this is a daily action that you do at night, right before you go to bed. You write down 3 good things, those things that you are grateful for. It could be as simple as sitting out on the porch with your partner, and you enjoyed that experience of togetherness, and you're grateful for that. Write that down. Perhaps it was the moment you savored that incredible cup of hot tea. Or perhaps it was a kindness from a stranger. Regardless, every day pause and write it down so that your brain can relive it. Second is 10 mindful minutes. It only takes 10 minutes to really lean in to this mindfulness practice. And if it's hard for you to sit, if you feel anxious when meditating, go outside and walk mindfully. As you walk mindfully, you will pay attention to how your foot hits the ground and the quality of the air as it moves in and out through your nose and mouth. And finally, acts of kindness. These are radical and intentional opportunities for you to thank people around you. Writing a note to one of your caregivers for the ways in which they have loved you through this cancer experience not only increases their experience of gratitude towards you, but you get a big dose of oxytocin yourself, the love hormone. Again, over and over in the literature about resilience, these 3 things, these 3 daily actions come up time and time again. Writing down the things that you're grateful for and hopeful for, pausing mindfully every day, and looking for ways in which you can be kind and grateful to others. So here's what I want you to remember when we conclude this session. Distress and depression are common. They are also treatable. You now have a list of things that you're concerned about, and you have now have the power to walk into your next office visit and ask for those distress and depression symptoms to be acknowledged and taken care of. Again, don't do this alone. Resilience can be learned and strengthened. So it doesn't matter if you're wired to see the world as half full or half empty. Resilience is the skill that reminds us that our cup can be refilled. Finally, acknowledging grief really, truly matters. It is a way for us to have our experience with cancer fully seen and heard. And you don't have to do this alone. Community is always stronger than cancer, and the ways in which we activate hope, increase our resilience, and are able to access support is by having people collaborate and walk alongside us. So perhaps you're not sure where you can go for support. Certainly, your oncology social worker at your cancer center can be a humongous resource for connecting you to local support and resources. However, the cancer support community also has some options for you. First, our cancer support helpline. This is staffed by licensed mental health professionals and resource navigators. We are available to assist you and to speak with you and your loved ones every day from 9 a.m. to 9 p.m. Eastern. Our online community is called Lifeline.org, and we really believe that our discussion boards and our helping calendar and the blogs that you can write can really transform your experience through both community and connection. And finally, there are some other resources on our cancersupportcommunity.org website that I can point you to. The Cancer Experience Registry. This allows you to tell your story and give voice to your full experience. Our Open to Options program allows you to come up with a list of questions that really reflect your goals and your values, particularly when you're making a treatment decision. And finally, we have a full range of educational materials, a podcast, both in digital and print, called Frankly Speaking About Cancer, that I invite you to check out.